Welcome, Dr. Brian Mayhugh, to TNT Open Mind Insights. We're really excited to host you today and talk about what you're working with right now. You are the CEO and co-founder of MindStreet, which is a cloud-based, human-supported CBT platform that has so much potential. It's research-backed. It's so exciting, and I can't wait to dive in and find out more about it.
Great. I'm glad to be here. Thanks for the invitation.
Yeah, absolutely. So before we talk about your platform, you've been in the behavioral health space for a long time, and that could be a whole program in itself. But can you give me a little bit of background on, you know, your past and why this topic? Why have you dedicated your career to mental health and behavioral health?
Well, I really started my career with direct patient care. So I was in graduate school in the early '80s and had my training and um, mostly inpatient and residential outpatient services as a psychologist. Um, I was fortunate enough to have my training at a time where medicine was really moving to evidence-based care and looking at protocols and ways to make decisions and consistent methodologies. Uh, I can remember that we had one of my first experiences was with a certification called JCAH, which was
Mhm.
Joint Commission on Accreditation of Hospitals. And they were really pushing to make decisions, to look at outcomes in a structured manner so you could report your outcomes. And interestingly enough, the that kind of morphed into working with one of my mentors was a quality assurance specialist. She was focused on looking at maintaining quality in mental health care. So ended up writing in graduate school, writing some protocols for insurance companies
Mm.
in order for them to make decisions on what they were going to prove for authorizations for payment. Um, I also grew up in the industry. My dad, clinical psychologist, was very active in some of the early inpatient work that psychologists were doing here in California. So I've been exposed to hospital practice and then eventually managed care services.
Mhm.
So we, towards the end of the '80s, I got to consult on some projects to help uh, systems implement procedures and protocols to admit and to treat patients. So I got very interested in that. I continued to work in the clinical fields, and then early '90s, I started working in healthcare finance, in insurance, in managed care, managing benefits for large companies, being able to solicit network providers and hospitals and contract with them. And I really kind of got into that finance and the analytics side of things. But during that time, I had patients that we were responsible for finding resources for that were really struggling.
Mhm.
Um,
What were they struggling with?
so the problem was struggling with access and real good clinical care. Um, we had patients that we were responsible for that were in metropolitan areas and they had access to, you know, the major universities and they could get resources, especially if they were struggling. And the level of training around those areas was very good. So they had, all the providers really had access to good resources to learn best practices. Well, I got connected and I found this group called the Beck Institute that was associated with University of Pennsylvania, and Dr. Beck was the father of cognitive therapy, so they had a training
Mm.
organization there, and I was able to create a program where we were able to use them as a training organization. Yeah, it was before the time of Zoom and everything else, so it was via tapes.
Mm.
To have that individual that's in a remote area that's seeing a patient, they have a good relationship, but they were really stuck.
Mm.
And to have that person get the training and the supervision from a world-class organization to help that particular individual that we were trying to find resources for, and the outcomes were just amazing.
Hmm.
And of course, I've been doing this for a while, and some of our earliest cases, there were some that became therapists, and some that went on to do some pretty great things. They were able to get through their depression or their anxiety and their mental health challenges.
Wow, so you were saw the beginning of CBT.
Yes.
Yeah,
Well,
so
I was the acceleration of CBT.
yeah.
Yeah.
So tell me in a nutshell, what is CBT
Okay.
and why is CBT such a great tool out of all the tools out there?
So CBT, it's a practical approach to helping you with your mental health challenges. So you're teaching the individual about their thoughts and their feelings and their behaviors.
Hmm.
They're helping you identify maladaptive thoughts. And then if you're able to change those way in their thinking, you're able to go ahead and really change the way you feel. And you can also change the way you behave. So
So if you can
all
change your thoughts, you can change how you feel and change how you behave.
yes,
Yes.
which can lead to much improved life circumstances.
It sounds simple. Is it simple? It's
Um,
not simple though.
it's not it's it's not simple because we are very entrenched in some of our beliefs and our
Hmm.
thoughts, the way in which we think about ourselves and our situations.
Hmm.
So it does take work to modify the way you think.
Yeah. And so
Yeah.
CBT stands for,
Cognitive behavioral therapy.
yeah, so connecting those pieces of thought, behavioral, and
Mhm.
feelings.
Yeah, there's a lot of teaching that goes along that the
Yeah.
therapist does. So really teaching you the skills to be able to address and change those things.
Yeah. So tell me about the teaching aspect versus the human supported aspect and how you've kind of been able to uh, address, the time element through your programs.
Sure. So our program was created by one of the early mentees of Dr. Beck, Dr. Jesse Wright, and it was also one of his co-authors was Dr. Michael Thace. Both of them well published. One from University of Louisville, the other from University of Pennsylvania. And the Dr. Wright's concept was we can take this psychoeducational and we can use technology to teach people these skills that are repeatable for most every patient that you would see.
Yes.
So there are basic concepts that you learn. There's basic tools that you use, and in cognitive behavioral therapy, part of it is being able to do homework. So being able to practice those things, so you can actually put those in place. So Dr. Wright came up with the idea, and he developed this program. He's the author of our program at MindStreet, and you you have very short information in terms of teaching. So you've got Dr. Wright narrates these videos. They're a couple minutes a piece. Kind of fortuitous that TikTok is like that now. Basically hold your attention for a short period of time. So they give you a piece of information, and then um, we have actor-based videos that show you what a person who has experienced some depression or anxiety or these mental issues. It shows you what they're thinking and feeling, and in their environment. So it shows them interacting with people in their life, whether it's a friend or their coworker or their significant other. But it shows you what they're really the challenges they have and the maladaptive thoughts. But it
Mm.
also shows you how they're able to implement these tools as they are, quote, going through therapy with Dr. Wright, in order to make changes in their thinking and make the changes in how they feel and be able to activate and have more sense of control over their life.
Wow. Okay. So tell me how it works. Like if you get a patient and they're going to go to MindStreet,
hmm
they're going to go and find a library of videos.
So it's really yes, there's some of that.
Okay.
But as a clinician, what you would do is you would go ahead and invite your patient to onboard and to start this program. There are basic self-reported assessments that would start. Yeah, they have the basic ones, PHQs and the GADs, and there's also some clinical diagnostic interviews that are available if the doctor wanted to use those. So they can gather some information at the beginning that really is a time saver for the clinician, and it also will then give them a baseline for the later measurements throughout the program and at the end of the program. But when you onboard a patient, they're going to have to go through this program and learn these things in step. So there's really an order of operation of teaching the cognitive behavioral skills, similar to have your first class on complex calculus without having the prerequisites that when you first get into college, right? So one of the things that we do is we take them through the program. They log on, they'll take the lessons. It's really nice because they can do lessons just a couple minutes at a time or 20 minutes at a time, whatever they want, whatever they have the time and they have the ability to focus on it. Um, and you can stop and start anywhere in the program. The only thing is you can't jump ahead. You can always look at stuff that you've done
Mm,
before, but you've got to learn the steps and you've got to go through the program in order. So you'll watch one of the doctors, Dr. Wright, will give his lecture or his little piece. Then you'll see the videos, and then you'll do some content mastery quizzes,
okay.
and they will gently correct you if you're don't get the answers right. And then finally, there's the homework where you will fill out your how you're thinking and you develop your strategies to overcome the things that are really particularly important and they're affecting you right now.
I love that. It
Yeah.
sounds very just like organized really well. So
Hmm.
you've got the teaching, and then you see an actor-based like example of it. Then you've got the quiz. Is that what you call it? The
Quiz.
quiz, and then the
The
homework.
homework.
So then you're going through all of those steps. Now tell me about the human supported component of this.
So there's two aspects. Obviously, your clinician,
Yeah.
is going to be supporting you, and that clinician could be a psychologist, psychiatrist. It could be a marriage and family counselor.
Hmm.
It could be a primary care provider, primary care practice. Could implement this and actually leverage some of their medical staff to help along in the human portion of it. Um, for the person that's actually prescribing it, there's a dashboard
Hmm.
that helps them monitor where they are. They know how well they're getting the material.
Yeah.
They know exactly where their self-reported measures are, and there's all a graphic display that's really easy to read. It's kind of like reading a lab report, and you've got the
Yeah.
red, yellow, green
Yeah.
formats. But in terms of that human aspect, we know that digital therapeutics make a difference in terms of people that
Okay.
use them
Yeah.
can actually have improvements. But when you add that human touch, somebody to walk alongside you with the program to encourage you and to just check in on you,
Maybe some accountability even.
accountability,
Yeah. Hmm.
yeah, and that someone cares about you
Yeah.
and they're checking in. The compliance goes up significantly and the outcomes improve even over what you have if someone was doing it on their own.
I
So that's
love it. It's like a best of both worlds approach because
exactly.
the clinician doesn't have to go through all of that time of laying out the material, and the person can do it on their own, but yet they still feel supported by a human and
Yeah.
walking alongside them through the journey.
Yeah.
It's very exciting.
It is. It's exciting. And, I think that there's an interest in AI being able to do is much more in our field.
Hmm.
But right now, what we have is we've got techniques and we've got tools to use that we can use right now for these folks who are struggling. And that human right now, that human touch really escalates the outcomes, improves the outcomes, um, and it really is a force multiplier.
Yeah,
You
yeah,
can
because you're
see
taking
peace.
that teaching piece and putting it like that seems like an appropriate use of technology.
You're taking the burden off the provider.
Yeah.
Yeah, and we've seen what tools like EHRs and other tools that we have out there that in technology that have helped providers in medicine. This is similar to those.
Yeah.
It takes that activity that the provider can offload to technology, and so they can really focus in and do what they do best, and that's the individual transactions with the patient.
Yeah, I love that. So that it actually enhances the human touch because they can focus their time not on the teaching, but the supportive element.
Yeah, and you're not getting burned out.
Yeah, cool. Yeah, I love that.
Yeah.
And then, okay, this this is going a little deep here, but like, do you think that AI can replace that human supportive element?
I think AI can help with engagement and with onboarding.
Okay.
I think it can help collect information about an individual, about what they like to do, about who's important to them, what their activities are like, and it can help the both the program and the clinician use those things that are really individualized to that
Hmm.
client, um, to move forward. But I personally think that there needs to be a human in the loop, and it doesn't have to be the hour long session with the therapist. It could be just the check in with the medical assistant, or what would be really useful is to have like a licensed professional counselor or a social worker embedded in the primary care
Hmm.
workflow, so that they could take and they could do those things.
Hmm.
The reality is, you know, primary care patients go to their medical home for everything. Everything pretty much starts there, unless they start at the ER room. But everything starts at the primary care home, and whether or not you recognize it or not, that's where most of the mental health issues are really
100%. Yeah,
they
show
they show
themselves
up.
there. Yeah.
So what happens when you have somebody who's got a complex chronic condition that's affected by their mental health status and their ability to follow through on medical recommendations and those things?
Hmm.
What you end up having is your 15-minute scheduled meeting as a primary care physician becomes 40 minutes.
Hmm.
At which point you have one or two of those, and your schedule is pretty messed up for the rest of the day.
Yeah, that's tough. So then they have a tough decision. Either I spend the time with this patient who needs it, or I kind of side skirt it a little bit so I can keep my schedule in line.
Hmm.
That sounds so hard. And I'm also thinking about our folks that are in rural areas where if
Yes.
they refer, it's an 8-hour drive. But now this is a real like robust evidence-based tool that they could put into practice or put into play within their practice
Hmm.
right away and support it on that time schedule, but people are getting like a really effective treatment.
Yeah, so these kind of tools are available to use in a rural practice. You could actually do your telemedicine visits. It could be your check-in. It doesn't have to be
Oh
in
yeah,
person. You
yeah.
could actually do those check-ins either over the telephone or televideo, whatever methodologies you have for your practice. But using the tools, you'll be able to produce um, excellent education for these clients so they can learn how to do these things. And of course, there's also an advantage to them learning and participating and learning this material, as opposed to just sitting through and getting a lecture for an hour session. So it's really an interactive way of learning, and takes multiple modes of input, and they can become proficient,
Mhm.
even though they're 2 hours from their therapist or their doctor.
That's very exciting
Hmm.
because there's so many people that lack access due to that geographic component.
Sure.
So this really helps that. And then tell me a little bit about the difference between your program versus the many apps out there that are meant
Mm.
to address these issues.
Our app is is all cloud based. We've done that for a reason. One, it really allows people to use it on any device that's connected to the internet. So it really does, yeah, in terms of democratizes the access to the program.
Okay.
The other apps, there are lots of apps out there. There's
Tons, yeah.
tons of
Hmm.
apps. Our application, our program has been validated by NIH research trials in academic settings. We have an interesting history. So our program goes back over 2 decades.
Oh, wow.
And the first study took a look at what happens when you digitize this material and then use it as an adjunct along with the therapeutic support. Well, they did that and it ended up showing, wow, the recovery curve and the durability at 6 months remains the same.
Hmm.
So, same as gold standard psychotherapy with a
Wow.
CBT therapist. So these are highly trained university
That's
folks that
amazing.
successful doctors. So the good thing is you can get the same outcomes.
That's amazing.
Yeah.
You must be
So
yeah.
but then why does that matter, right? Why is that important? So you have a program that can do some of that stuff. Still don't you want the doctors to do everything? And well, if you implement this tool, the next study showed that you can actually see significantly more patients. So it takes one fifth the time of the provider's devoted time. It's one third the cost. And what's really interesting is the completion rate on the program is 1.5 times better than it showed than the face to face sessions.
Wow.
So you kind of wonder why would they complete it faster? Well, this is a very convenient program and you can do it at your own pace.
Mhm.
You don't have to drive and take off time from work and do those
Mhm.
things. So it really does open up the opportunity for the patient to be able to treat it in their own home and in their own environment with minimal friction.
And with the support and accountability of a human on the other side
Exactly.
too. So tell me, what types of conditions can CBT help?
So CBT has been studied in a lot of different conditions. Anxiety and depression were the primary ones that they initially looked at. There is some indication that CBT is helpful with some psychotic features, also with assisting people who are helping people with serious mental illness.
Mhm.
So it has a wide range of disorders that it's been studied against. Um, the tool and CBT, the basic principles can be used by anybody. In fact, it could be used by you and I in our everyday life.
Maybe I should look into it.
There you go. There you
Because
go.
like it sounds like amazing information,
Sure.
even before you get to a
Get to a diagnosis.
yeah,
Yeah.
because it's just like life improvement.
hmm
How old do you have to be to use the
For
program?
our program, it's 18 and above.
18 and above.
Yep,
Okay.
18 and above. So it's adults.
It'd be neat to make one for kids too at some
There
point.
there's some interest in making some
Yeah,
for youth too.
yeah.
Yeah.
And then could you tell me about comorbidity and using it alongside other illnesses that people are experiencing?
Yeah. So, and this is a perfect example of where the primary care medical home, they're going to see those comorbid patients. In fact, I recently read that there was 40% of the visits that a primary care doctor sees has some sort of a behavioral health component to it.
Mm-hmm.
That's a lot.
It is.
And, for example, if you have somebody who's, recently been diagnosed diabetic and they need to implement a new exercise routine and a diet and everything else, someone who's got some symptoms of depression or symptoms of anxiety, it's going to be more difficult for them to follow through
Mm-hmm.
and to be able to comply with their medical treatment plan for the chronic conditions. And there are multiple other chronic conditions you could apply the same to.
Mm-hmm.
Programs have been studied in use with diabetic populations, with cardiac populations, with multiple other treatments as an adjunct. So they're really looking at using the cognitive behavioral therapy tools that are available digitally to really not only force multiply for the mental health conditions, but also force multiply and improve those chronic conditions using these skills so they can be more effective at their treatment.
Makes a lot of sense. So, if providers are watching this, how can they learn more or put this into their practice?
So they can contact us at mindstreet.com.
Mhm.
They can reach out and request some information from us. They can obviously contact some of the folks with the TNT program.
Mhm.
We're very familiar, and actually, we're local to UC Irvine.
Mhm. Yeah, so I don't know, it seems so exciting and so effective. What excites you most about what you're doing?
What excites me is it it really gets out a significant standard of care because you're doing this in a digital format. The digital format is very controlled, um, and you take what is evidence-based treatment, and you're able to deliver it at scale
At scale. Yeah.
and consistently with the same quality every time someone logs into the program. So there may be some variability in the training levels of the providers, but what you're doing is you've got a very major portion of what the provider should be doing the patient, taking care of that is the psychoeducational part of that client relationship.
Yeah. So just taking a step back, and you've been working in this field for decades, and you
Hmm.
started out working with folks one on one.
Hmm.
I mean, it's kind of amazing. They started out one on one, and here
Yep.
you are working at scale. Do you still feel connected? What are your feelings about the macro view? And now you're multiplying this for so many people.
Well, I feel like we are back to seeing people one to one. I'm not doing it personally, but we're providing resources so that clinicians can really take care of their population and their people. That they can, we get into this business to make a difference and to help people. And so I think that I'm doing that on a macro level, and I just happen to be fortunate enough to be at the right place at the right time with when healthcare was kind of transitioning and where these kind of tools were just being implemented. And then now I've got the opportunity, after being involved in managed care for such a long time, managing large populations through numbers and protocols. I'm back to the clinical side in terms of finding those tools that'll be important to use with each of the patients that walk through the door.
Yeah. I think your dad is probably really proud, huh? Did you
He's
co-found this
Yes.
together?
So
Yeah.
yeah, my dad, psychologist. He we co-founded this, and we have another co-founder that's involved, and she was very involved from a personal level. So this is a personal and really important program for her. She feels like she wants to help people.
Yeah.
So yeah, with my dad, we've worked together for almost 40 years.
That's incredible.
Yeah.
That's
Yeah,
incredible.
it's a lot of fun. We've done the inpatient hospitals. We've had those. We've had managed care programs with TPAs and employee assistants, and now we're focused on getting these direct services to clients again.
Yeah, I mean, what a legacy.
Yeah.
What a legacy. What would you like to see if you were to see this take hold? Like, what is the future you would like to see for our communities with this product?
That I want to see this be able to be utilized by both specialty care and primary care. In fact, we have some projects kicking off with large primary care systems. So health systems that have significant network of primary care locations, both in metropolitan and rural areas. What I'd like to see is I'd like to see those programs be able to reach out and address and teach the people at scale about cognitive behavioral therapy using our tool. Um, we have an unbelievable resource in the doctors that are our scientific advisors, and they're some of the leaders in the industry. And so, the more we can get out there in terms of these evidence-based practices, the more people can be helped. And it's it's a cost-effective way to deal with a problem that's not going away.
Yeah.
We don't have enough providers to see patients one to one right now, and it looks like those are declining.
Mhm.
So we've got to do something because the mental health challenges aren't going to go away, the comorbid issues aren't going to go away. We've got to find a way to reach people and be able to get them the help that they need.
Well, I'm grateful that there's people out there like you and your dad and
Hmm.
all the experts putting all this together and creating a solution that makes sense from
Hmm.
so many different perspectives. So,
Yeah,
thank you so much for coming and sharing your work with us.
sure,
I
it was a
really
pleasure.
appreciate it.
Thank you.